6 medications that dramatically raise your risk of heart attack after 60. Warning: if you're over 60 and taking any of these 6 medications, pay close attention right now, because what I'm about to tell you could save your life today. After more than 20 years working emergency rooms and cardiac ICUs, I've lost count of how many patients came in mid-heart attack having taken one of these medications the night before. The worst part? Almost every single time, it was doctor-prescribed. Today, I'm going to show you exactly who these silent killers are and how to protect your heart before it's too late. And listen, one of the last ones on this list is going to genuinely shock you. It's something sitting in the medicine cabinet of nearly every American over 60. Is it in yours? Quick disclaimer before we start. This video does not replace your doctor's guidance. Do not stop any medication on your own. My goal here is to give you the right information and the right questions to bring to your next appointment. Silent killer number 6. Decongestants, the hidden danger in your cold medicine. You're stuffed up, can barely breathe. You run to CVS, grab a Sudafed, Dayquil, or NyQuil, and within 20 minutes it feels like a miracle. But here's what nobody tells you. Drugs like pseudoephedrine and phenylephrine don't just work on your nose. They act like a clamp that tightens the blood vessels throughout your entire body, including the arteries that feed your heart. They flood your system with norepinephrine, your body's stress hormone. Picture your heart now trying to push blood through tubes that just got narrower and stiffer, beating faster and harder to keep up. If you're over 60 and already have some plaque buildup in your arteries, that added pressure can trigger a spasm. The artery closes. That's the heart attack you bought at the pharmacy. Studies show these drugs can double your risk of heart attack or stroke in the hours following use. And here's the kicker. In 2023, the FDA concluded that oral phenylephrine, found in almost every cold and flu product on the shelf, is completely ineffective. You are accepting the risk of a heart attack for a benefit that doesn't even exist. That is the worst trade you'll ever make. What to do instead? Saline nasal rinse, a neti pot, a humidifier. If you need medication, plain loratadine is far safer. Don't trade your life for 20 minutes of breathing clearly. Silent killer number 5. NSAIDs. The danger hiding in plain sight. Headache, ibuprofen, back pain, naproxen, Advil, Aleve. Seems harmless enough. After all, these are the best-selling drugs on the planet. But what happens inside your body when you swallow that pill is alarming. Your arteries have a personal bodyguard called prostacyclin. Its job is to keep your blood flowing freely and stop platelets from clumping together and forming dangerous clots. When you take ibuprofen, naproxen, or diclofenac, you block an enzyme called COX-2, and that bodyguard gets fired. Without it, your body goes into a triple collapse. Your blood vessels constrict and your blood pressure spikes. Your blood becomes sticky and clots form with frightening ease. And your kidneys stop filtering properly, retaining sodium and water, forcing your heart to work overtime. Narrowed vessel, clot, exhausted heart. The perfect storm for a heart attack. In 2015, the FDA doubled down on its warning. The risk of heart attack can begin within the first few weeks of use, even in people with no prior heart problems. Diclofenac raises your risk of a cardiac event by 70%. High-dose ibuprofen more than doubles your odds. There is one important exception that saves lives. Low-dose aspirin does the opposite. It protects the heart. Tylenol, acetaminophen, which is a pain reliever, not an anti-inflammatory, is also a far safer option. If the pain hits, don't gamble with your life. Talk to your doctor about these alternatives. Silent killer number 4. Omeprazole and proton pump inhibitors. The one that's going to shock you. Prilosec, Nexium, Prevacid. The stomach protectors that sit in the medicine cabinet of roughly 7 in 10 Americans over 60. Everyone assumes they're harmless as water. But science has discovered something that will genuinely surprise you. PPIs don't just work on your stomach. They attack the cells lining your blood vessels and dramatically reduce production of nitric oxide, the compound that keeps your arteries relaxed, flexible, and young. Without it, your vessels become stiff, inflamed, and atherosclerosis accelerates. A Stanford University study of nearly 3 million patients found that PPI users have up to 21% higher risk of heart attack, including young, otherwise healthy adults. A separate study found that long-term use can double the risk of cardiovascular death. The critical distinction: taking a PPI for 7 to 10 days to treat an acute episode of acid reflux is not the problem. The danger is blind, indefinite use, months or years without ever questioning whether you still need it. If you've been on one for a long time without revisiting that conversation with your doctor, that conversation needs to happen now. Silent killer omega-3, ADHD stimulants, and diet pills. The productivity trap. Adderall, Ritalin, Vyvanse, Concerta. What started as medication for children with ADHD has become a widespread trend among adults chasing focus, performance, and productivity. And worse, many people are using them without a diagnosis, on the recommendation of a friend, a podcast, or a Reddit thread. The mechanism is simple and dangerous. These drugs flood your bloodstream with adrenaline. Your heart races, your vessels tighten, your blood pressure spikes. A 2023 Swedish study tracking 278,000 people found that 5 years of use increases cardiovascular disease risk by up to 27%. The risk of hypertension climbs to a staggering 80%. And in adults over 65, the risk of cardiac hospitalization jumps 40% within the first 30 days alone. Watch out for weight loss supplements and pre-workout products too. Many contain stimulants that were never FDA approved, or that have already been banned. I have personally seen cardiac arrests caused by those brightly colored bottles that look completely innocent on the shelf. Silent killer SERBA-2. Corticosteroids, the miracle with a hidden price, prednisone, methylprednisolone, cortisone shots. The injection that erases your shoulder pain in 2 hours feels like a miracle, and in a sense, it is. But every miracle has a cost. Corticosteroids attack your heart through 4 pathways at once. They retain sodium and raise blood pressure, they spike blood sugar, they worsen cholesterol, and they thicken the blood, making dangerous clots far more likely to form. A study published in the British Medical Journal found that doses above 7.5 mg per day of prednisone double cardiovascular risk. Here's the trap most people fall into. A patient gets a cortisone shot, thinks it was just a quick injection, and moves on. What they don't realize is that a single shot can be equivalent to nearly a month's worth of oral steroid acting on the body, silently, invisibly, putting enormous strain on the heart without a single warning symptom. Silent killer number 1. Testosterone. The fountain of youth that can become a loaded gun. Testosterone injections, testosterone pellets, testosterone gel. Men's health clinics have exploded across the United States prescribing this to men over 50, and a significant number are using it without any documented deficiency. My levels were at 400, doc. I had to do something. In many of those cases, no, they didn't. A 2014 study of 55,000 men found that in the first 90 days of use, heart attack risk increased by 36%. In men over 65, that risk doubled, and when it doesn't trigger a heart attack, it triggers a stroke. I had a patient, healthy, mid-50s, perfect annual physical, who suffered a stroke just 1 day after a testosterone injection. He is now in a wheelchair. The reason? Testosterone can thicken the blood to the consistency of syrup. Thick blood in a coronary artery is a death sentence. But I only use gel, Dr. Walker. That's not as strong. Don't fall for that reassurance. A study published in JAMA found that testosterone gel significantly increases the volume of soft, non-calcified plaque inside the coronary arteries. These are the most dangerous plaques. They may look mild, but they can rupture without warning and cause a fatal heart attack with 0 prior symptoms. My position is clear, and I'm not going to soften it. I am against the use of exogenous testosterone outside of extremely well-selected cases, confirmed deficiency, proper baseline testing, and consistent monitoring. The problem isn't the medication itself. It's an industry that profits from prescribing it to people who don't need it, without blood work, without follow-up, without accountability. I've seen clinics prescribe testosterone to women with a history of breast cancer. That's not medicine. That's negligence. The 6 silent killers, one more time: NSAIDs, decongestants, proton pump inhibitors, stimulants, corticosteroids, improperly prescribed testosterone. My one request: don't stop anything on your own. Take this information, bring it to a doctor you trust, and ask this one question. Do I actually still need this? Is there something safer for my heart? That question can save your life. If you want to know the 6 medications that actively protect your heart, the ones the Cleveland Clinic recommends, type "protectors" in the comments below. Enough responses and I'll make that video next. My name is Dr. Sebastian Walker, cardiologist. Take care of your heart. It's the only one you've got.